And we are interrupting programming for just a few minutes to give you the latest update out of South Carolina. Governor McMaster is addressing the state today about the COVID-19 response. Here he is.
Businesses, and now we've issued another to expand that. And this includes, this is starting Monday at 5 p.m., furniture stores, jewelry stores, department stores, clothing stores, shoe stores, clothing and shoe accessory stores, florists, sporting goods stores, book, craft, and music stores, luggage and leather goods stores, and home furnishing stores. Such things as hardware stores, these are not included. Hardware stores, firearm retailers, and home improvement stores are not included in this order, and all that will be made clear in the written order when it will be issued. But again, that will go into effect Monday evening at 5 p.m. Also, I have issued another order that goes into effect right now, and that is about short-term rentals in our state. I'm hereby suspending short-term rentals to persons from CDC, that's the Centers for Disease Control, identified places, hotspots, states, from coming into the state beginning right now, rentals starting right now, no new rentals of those places starting right now indefinitely. And that includes hotels, short-term rentals, motels, vacation homes, condominiums, resorts, bed and breakfast companies, timeshare companies, but this specifically excludes people from any place that are military, medical, first responders, or commercial transport people. So those are the two executive orders. Those are new. As you know, we are taking a deliberate, steady, planned approach. We believe this is the best way. It's based on the science, based on the facts, based on the advice of the professionals, and we will go as far as we need to or as advised to keep the people of this state safe. And with that, Dr. Bell.
Thank you, Governor, and good afternoon. We have now received reports of documented cases of COVID-19 in every county across our state. This includes 147 new cases as of today, which brings the total number of people confirmed to have COVID-19 in South Carolina to 1,700 cases. We are at the point where we are reminded daily of how serious this situation is and the obligation we all have to help prevent the loss of additional South Carolinians. Know that we are all in this together, and at some point many of us will likely be exposed to the virus. And the level in which the virus continues to spread will rely on all of our actions. We want to reassure the public that so many of us are working hard together as a team from the local to the state level and with national partners to protect the health and safety of all South Carolinians. As of today, we continue to work with healthcare facilities to stay updated on the availability of acute care beds throughout our state, and currently we are at 52% capacity. We are working with our emergency responders on an electronic system that will allow them to determine if they are responding to a house where there has been a recent COVID-19 patient. This will give our first responders additional information to protect themselves appropriately. And we have provided a third round of PPE shipments to the counties from the Strategic National Stockpile. We know that this is a challenging time, and what we're calling on everyone to do is not easy. We encourage all South Carolinians to take actions to protect themselves and those they love. Nearly every day we learn of a new case that is the result of an unexpected exposure or an unknown source. And what our current data shows is that social distancing and staying home helps combat the spread of this disease and ultimately saves lives. And so this must absolutely continue everywhere until we see a significant decline in these cases that is sustained. We are always mindful that each new case represents a real person. We anticipate releasing counts of confirmed and estimated COVID-19 cases by zip code later tonight. We will provide estimated cases at a later time, but those will represent those who are likely undiagnosed or untested. And by including estimates, we hope to better convey more meaningful information about the real risk of disease spread in our communities. We ask for your continued cooperation with following the guidance of public health professionals so that we can continue to fight on every individual's behalf. I ask everyone to please do your part, to stay home and limit your close contact with others so that we can slow the spread of COVID-19 infections. And as always, for the latest information, please visit our webpage at scdhec.gov/COVID-19. Thank you.
Thank you. Mr. Davidson.
Thank you, sir. Thank you, Governor. My name is Nick Davidson, and I'm the Acting Public Health Director at DHEC. We've produced a couple products recently, and we thought it was wise to show you one of those products. We'll be making that available on our website, and we'll be showing it here on the screen momentarily. The video or the animation loop that we're providing to you is an attempt to make it clear about the cases as they spread around the state. You can see in the video here that it starts in early March, and the cases begin to grow throughout the state. And as they progress towards 1,700, you can see the heat map is showing that progression to the current date. So this will be available on our website, and we always try to do what we can to express the risk that people face if they don't take some of the precautions that we advise against. And so the opportunity here to see the spread, we hope will be a sobering reminder of the need to take precautions as people go about their lives throughout the day. So that will be available on our website this evening. I also wanted to talk about our efforts in our laboratory. We continue to be very proud of the work that our laboratory staff and officials are doing. We are working through extended hours. We're working 7 days a week to do the testing that we need to get done in the state. We're using even extended hours during those 7 days, and we run samples throughout the night as well when necessary. So we have not recently had a backlog. We currently do not have a backlog. We are currently working through a challenge where we probably have enough materials, enough reagents in the laboratory to test the rest of the specimens today, and then some of the specimens that we'll receive tomorrow. But if we don't receive additional specimens, we do anticipate going into a bit of a backlog scenario. So we're working with our partners here in emergency management, with the governor's office, and with our federal partners as well, and the suppliers to try to make sure that we can continue testing. The last thing we want to do is have a delay, but I also want to be very honest and transparent with you that we are potentially facing a delay over the next day and a half or so. We'll certainly let you know as that changes, and we certainly hope that we get some supplies in, but we don't have any scheduled for delivery. So we're doing everything we can to make sure that we don't have any backlog. Thank you.
Thank you. Ms. Butler.
Hello, my name is Jennifer Butler. I'm with the South Carolina Department of Mental Health. And as we've been talking about making sure we're caring for our physical health, we wanted to make sure that we drew attention to paying attention and care to our mental health. The Department of Mental Health is open, fully operational and functional across all of our inpatient facilities and our community mental health centers. This is a tough time for everyone. Certainly our patients who already struggle with anxiety, depression, isolation may have an exacerbation of symptoms. But those of us who may have not previously struggled with any of those symptoms may find ourselves now feeling anxious, feeling concerned and worried or uneasy. The Department of Mental Health and many other resources that they'll list on the screen are here to support you during this time. As we stay at home to save lives, we still need to stay connected. So if you are feeling suicidal, we urge you to call the National Suicide Prevention Hotline. at 1-800-273-TALK. We also have the crisis text line, which is, both of those lines are answered 24 hours a day by trained counselors. You text the word HOME, H-O-M-E, to 741-741. The Department of Mental Health also provides South Carolina with a unique opportunity to respond to the mental health concerns during this time because of our statewide system. We have clinics in all 46 counties of our state. We are also able to roll out a community crisis response and intervention team, essentially a mobile crisis that is available 24 hours a day, 7 days a week. The number you see here for the 1-833-DMH-CCRI, that is for that.
And this is the latest briefing from Team South Carolina from the Emergency Operations Center in Columbia. A couple of big things to come out of this briefing from the governor today. So as of Monday at 5 p.m., there will be more business closures in the state, things like furniture stores, things that are not considered essential businesses. We're going to put that list up for you at WSAV.com. He did make a point in saying that home improvement stores will still be opened. Also effective immediately, they are not allowing any short-term rentals or hotel reservations or resort reservations for anyone who is from one of the areas that the CDC has determined is a hotspot for COVID-19. They're trying to prevent people from those hotspot areas from entering the state of South Carolina. We also heard from Dr. Bell, who says the state has 1,700 confirmed cases now, and what they're working on is an effort to release some estimates about what they believe is happening with the spread. They said that would help give the public a better picture of what's really happening, because you know there has been a lag in the testing up to this point in a lot of parts of the country. So that's the latest on the health side of it.